welcome everyone. It's wonderful to be with you. The chat is open. We are going to be leaving it open for engagement, and we'll come back to it at the end during our Q&A session. My name is M.A. Brill, and I'm one of the co-directors along with Chanel Portia Albert of JustBirth Space, and I am here along with my colleague and JustBirth Space lead educator, Erica Livingston. And today we're going to be talking about community-based pathways towards healing, transformation, and hope for birth justice. Also want to share that Chanel sends her regrets. She's not well today and is unable to join us. So I know how much she wanted to be here with everyone, but unfortunately she'll have to watch the recording, and please, we're sending our well wishes to her. So we're going to get started. So we wanted to say greetings to everyone. Even though we're living through a difficult time, we believe that centering community care, love, and connecting to our shared humanity is helping us get through right now. And as we continue along with the presentation, we'll be kind of highlighting how important those values of connection and love and community care are in the work that we're doing towards birth justice. So this is just a roadmap for what we'll be discussing today. We're going to be looking at how we name birth justice and the work we're doing around building shared language, our JustBirth Space model, accountability and advocacy, and perinatal support, and then we'll open it up for questions and discussion. So JustBirth Space is a collaborative partnership between Ancient Song Doula Services, Village Birth International, Every Mother Counts, and Jacaranda Health, which is a health tech company that has worked in the US and in Kenya. Ancient Song and Village Birth International are community-based reproductive justice organizations centering community doula frameworks and birth justice and reproductive justice policy and advocacy. And Every Mother Counts is maternal health advocacy organization that supports and funds grantees from all over the world. So bell hooks is a huge source of inspiration and wisdom in the work that we do. And so we turn to look at those values that bell hooks has written about. And she writes, hope is essential to any political struggle for radical change when the overall social climate promotes disillusionment and despair. If you're familiar with Chanel's work, she speaks a lot about centering hope as a form of action, as well as a framework to understand what community care could look like. And so we include this quote often in the work when we're sharing or doing a training to really elevate how powerful centering hope can be as an actionable tool. So JustBirth Space, I want to talk about the model and have you all kind of get a better sense of what we're doing. JustBirth Space really came out of the collaborative work that we were already doing with our three organizations, Every Mother Counts, Ancient Song Doula Services, and Village Birth International, around advancing birth justice and community doula frameworks of care and core competencies around that work. And then the pandemic happened, and we were already in conversation about what does it look like to do and really operationalize and normalize birth justice along the health system spectrum. And when the pandemic hit, we took all of that conversation and all of those ideas and visions and models of care we were already implementing around community-based doula work and thought, what would that look like if we kind of innovated into and iterated into a virtual space without losing those core values that we're all working and practicing daily. So JustBirth Space is always free, it's always virtual, and it provides people with free, responsive, trustworthy virtual support to safely navigate pregnancy, birth, postpartum care. So it started with COVID-19 as kind of the impetus of this work, but has really grown and is moving beyond that as a support network. So we turned to the work we were already doing, and as I'm assuming most people that are already working in maternal health we know that racial disparities have only continued and have increased during the COVID-19. So those racial disparities around perinatal care and birth really became more apparent as a failure to communities that were seeking that care and deserve that care. And so we wanted to really start with the same questions we were already working with, to think about what does systems change look like? How do we address the inequities that are present currently in maternal health by centering Black, Brown, and Indigenous communities and the work of reproductive justice that's already been established and led by Black, Brown, and Indigenous people in the field. And so centering birth justice to us means really leaning into defining and naming what our core values are at JustBirth Space. And so we define our core values as anti-racism and equity, accountability, and inclusion. And so when individuals, regardless of race or gender identity, are able to make informed decisions during pregnancy, childbirth, and postpartum for themselves and babies, that is free from racism and implicit bias, without fear of coercion into unnecessary medical interventions, reprisal for refusal of care and or face inadequate medical care, and are able to express their full human rights around reproductive health choices for themselves and their families, that incorporates the intersectional and structural needs of individuals and communities. And so when we really looked at what does it mean to operationalize birth justice, how do we take this work and really put language to it, this is kind of what we came up with as a map and a connection of how all of these issues are intersecting with one another. So really uplifting bodily autonomy as a human right, informed consent, respectful maternity care from a global perspective as well as US-based perspective, incorporating human rights frameworks in the work that we're doing, and both in the way that we're serving communities and individuals and families, but also in the work that we're looking towards accountability with the health systems that we're working with and partnering with. Cultural congruency and understanding racism and discrimination and naming that explicitly, rooting and intersecting with reproductive justice and the history of reproductive justice models of care in the US, centering a culture of care, recognizing the intersections of health and race equity. So when we're talking about working with funders, when we're talking about working with health systems, we're also talking about putting race equity as and leveraging race equity as a value that is necessary in order to see the outcomes that we're seeking to change. Uplifting Black, Indigenous, people of color in leadership and community-based leadership models of care. So again, turning to what already is, not recreating the wheel, but deepening and kind of like fertilizing the ground that we're standing on, and turning to leadership that really matters around representation, addressing intergenerational trauma for people of color, so that really in the work that we do with the families that we're serving on our platform, as well as the community of connectors that we're working with, shifting from a trauma crisis-based focus to centering intergenerational hope. Those are some of the aspects that bring birth justice to life for us. So JustBirth Space's mission is to operationalize birth justice. And we've had so many conversations as we developed and implemented our platform on what does it really mean to operationalize something. And so this acronym CARE is connection, accountability, respect, and equity. And we make it a point to talk about care and love as not soft skills, but actually radical liberatory models towards change, and that we need that in order to work with each other and keep each other uplifted in the longevity of this work, but that people feel that shift in how they're treated when they're deeply cared and loved. And isn't that a human right that we should all be advocating for, especially in the health system that we're currently working with? So, so looking at this care model throughout the perinatal care system, from institutions to healthcare providers to birthing families. And so these are kind of the arms of our work: community-based virtual perinatal support, workforce development, and systems change. So community-based virtual perinatal support offers, again, free virtual support for pregnant and parenting individuals via our text line, which we'll talk more deeply about in a minute, our one-on-one video and phone calls, and then our virtual support groups and classes. And all of our support is offered in both English and in Spanish. And then workforce development, we support a community of 10 connectors that are all people with expertise and experience rooted in community-based doula care, postpartum support, birth justice, childbirth education, IBCLCs, and our culturally congruent care. So when people are reaching out to us, we want to also be able to give back that level and standard of care that is rooted in our values and principles. And we have an incredible community of people that make that possible through our team. And then systems change. JustBirth Space promotes interconnection, healing, accountability, and transformation to break down the silos and power asymmetries in healthcare through our referral partners and our collaborations. And we'll go more deeply in both of those aspects of our work. And so how do these all intersect? What does it mean? As we were putting together this platform, we wanted birth justice to kind of be our root system, right? And when we think about root system, we're not talking about root systems that are grounded in soil that's not fertile. We're talking about systems of care that are rooted in care, right? And so from that, there's the possibility of something else. And I know this conference is focusing on innovation. And so for us, innovation in many ways means dreamscaping together, means going beyond just recreating something new for the sake of being new, but looking at what has already been established that we know works, and then honoring and investing and supporting that as a deep resource. And so our referral partners are intersecting with that root care of birth justice, the health systems that we're working with, and then JustBirth Space is really how we deliver that and extend that care to the people that are reaching out to us. Okay, I'm going to hand it over to you, Erica.
Hi, that was great. Thank you. So we really have a three-prong approach in the way that we support the families on the platform. And I want to dig into what those are and what we call it and how it works. So Emma already explained some of this, but JustBirth Space is a virtual perinatal support space. It offers support for individuals during the course of pregnancy, labor, birth, postpartum, and lactation and infant feeding. And we have 3 types of support. So the first way we're usually connecting with a person is through our text connect. So this is from 8 a.m. to 10 p.m., a warm line where people can send in a text to our line and immediately connect with one of our connectors, which is kind of our sneaky word for doulas. And this is through text or Facebook Messenger we're using currently. This is usually the first contact we have with folks. And this is sometimes for questions. Sometimes people are texting in, from the OB's waiting room, all kinds of questions across the spectrum of the journey to parenthood, and also sometimes just asking for emotional support. So it's not always just referrals and resources, it's also care. Then our next tier of support is what we call We Connects, which are phone or video support sessions that are one-to-one to answer more in-depth questions. We call this doulaing in small doses. So these are 15 minutes to an hour, depending on the needs of the person who's calling in. And these are deeper one-to-one to be able for them to ask questions that they might not feel comfortable texting in. And also, I'll talk a bit in a second about Community Connect, but also questions that they might not want to ask in a group setting. So this is much more intimate and care-based, where they can really get to know the connector, and we can build trust with them, as well as point them in the right direction for any future needs. And then there's our Community Connect. So these are our virtual support groups and our classes. These are held on Zoom. These are building community with other pregnant and parenting people. This is the space that I work in the most in Just Birth space, and I love it. It is amazing what is possible to happen in a Zoom room where we're all in a bunch of squares, but when everyone is there with the sole intention to look for care and community and build trust with one another, some real magic can happen. And we continue to see that in the support groups and virtual classes that we hold. So when we first started Just Birth Space, we were focused locally to New York City and New Jersey. But now it has blown up and we are now supporting people across the US, also with international growth as well. No one's turned away, basically, right? It is always free. It's available to anyone that hears about it. And though we started with these specialized and localized resources and referrals for people based in New York City and New Jersey, we have been expanding constantly. An example being the pregnancy support group that I run weekly. I was in last night. There were 16 of us in that group. It was I and one other person that were there from New York and New Jersey. The rest were all over the place. So it's really an example. For sure, when we started, that group would be mostly New Yorkers. Now it is a really wide lens, which is also a really fun way to look at the way they connect in that group, is that you don't have to be neighbors to be able to create community and care with one another when you're on the same parts of the threshold. So wanted to show you a bit of what our families experience when they text in with us, which again is kind of the first way that people are usually connecting with Just Birth Space. So they text the support line with any questions or an ask for emotional support. So this example shows, I've heard that hospitals have new policies for labor, delivery, and postpartum. How do I find out how these new policies affect me? And then the Just Birth Space connector, which is a support specialist, responds as promptly as possible, again, between the hours of 8 a.m. and 10 p.m. I really want to note here is that in a lot of environments like this where people are used to a text line, there are often barriers to the support, and we have no barriers to our support. So people do sometimes share with us where they're texting from, where they're located, right? Especially if they're asking a question like this about hospital policies, we will probably need to know where they are in order to find out the policies for them and help them on that search. But that's not required of them to share. So they don't have to require their name. They don't have to give us any data in order to be able to receive support, which we believe is really huge, to be removing that barrier. And nothing being required of folks to get care and love from the connectors. And then the connector continues to provide support until the person gets the answers that they need, including referrals, or even setting up a WeConnect, which is the one-to-ones, or redirecting them also to like, oh, it sounds like you could use a lot of support in the pregnancy. Have you heard about our pregnancy support group? And then sending them how to set up to get deeper care with us and continue on the journey.
Erica, one thing
So
that I wanted to jump in and add to that, I don't think we mentioned, is just that we're offering non-clinical support. And so we're really pulling from a doula support model of care, and, you know, explicitly also share with people that we're not diagnosing, we're not giving medical advice, but we do receive a lot of texts that I would say can be emergent, and they're looking for additional medical care that they're not receiving within the health system, and they're coming to us for that, for those answers as well as care. So there's a lot of bridging with health systems, but really making that clear boundary that we are non-medical in nature.
Yeah, and we make that clear, not just in an environment like that, but with them as well. And that goes across the line too, not just in text form. That's happening inside of our WeConnects and also inside of the Community Connect and group spaces as well. So our connectors, which is a group of 10 folks, are an interdisciplinary team of experienced community-based doulas, lactation counselors, childbirth educators, sex educators, and postpartum specialists who provide emotional, informational, and systems navigation support that is respectful, culturally congruent, and person-centered. We give localized support and referrals to wherever they are calling in from. Warm, welcoming interactions that are inclusive and safe for all identities, especially for queer and trans individuals. And we also provide our communication in English and Spanish. I think it's important to note here that the tenets that MA was explaining earlier, that JustBirth Space's soil is foundationally built upon, those are working inwardly as well as outward. So as someone who's been working for JustBirth Space as a connector from the beginning, I've never felt cozier in a workspace. I've never felt more like respected, cared for, and seen as a whole person in any work that I've done before. And I know that I'm not the only one that would say that. And I think it's important to think like this because when we want the work to go outward and the care to go outward to the people that we're supporting, one thing that's really different about JustBirth Space versus other places I've worked is that the care is moving inward as well. So an example of that would be, we have a Friday connector meeting. That is the meeting I look forward to the most in my personal week, because it is a space where, yes, we are talking about what's going on the platform, what's happening with the families we're supporting, and we are using it as an informational share space. It's also a time where we get seen as whole people, and we're allowed to show up in that space as who we are, which only deepens the trust and connection that we have between each other, which is also why the connectors are able to build the net that holds the families that we're supporting across the threshold. So just to explain a little deeper about our Community Connect offering. So these are our groups. These are virtual support groups and classes. They offer a space to address unmet needs, isolation, anxiety facing the pregnant people and parenting people, and build on the facilitation expertise of the program's connectors. So these are some of the ones that we currently offer right now. We have a weekly pregnancy support group, a weekly postpartum support group. We have a queer family space, single parent support group. We have a Spanish support group, infants feeding support, childbirth education in English and Spanish, prenatal yoga. We offer an induction basics course. We also have HEAL, which is our birth trauma processing circle, and newborn care and infant feeding. On the back end of JustBirth Space, which is often what people are interested about, how are we giving out the referrals and resources, and how is all of that collected, found, resourced, and then shared with the people that are texting in? So we created a comprehensive knowledge base with resources, referrals, and information on topics including community support and mutual aid, rights during pregnancy, birth, and postpartum, COVID-19 and pregnancy, adapting birth plans during COVID-19, the changing local hospital policies during COVID-19, how to navigate insurance and Medicaid, access to local social services, resources on maternal mental health, postpartum blues and anxiety, and finding providers who are Black, Indigenous, people of color, and LGBTQIA+ inclusive and affirming care providers as well. And I will note that the knowledge base is ever growing, ongoing. That was something Emma and I were just talking about earlier today, is it's like every time you're meeting with a new person, every time there's a new group, we're adding to that knowledge base and expanding what we are capable to share and provide. And I'm going to hand it back over to Emma for a little while.
Thanks, Erica. So direct to community engagement is so important to us as a theme in how we work, that we're able to reach pregnant and parenting people beyond our own networks and communities. You know, we use the word connect so much in our language at JustBirth Space because that's what we see ourselves doing in the role that we're playing. We want virtual spaces to not feel like they're losing that special quality of what it is when you're with somebody in person, right? And for all of us during, working remotely, being on more Zoom calls, it's a new way of being with one another. And so what does it mean to kind of shift into a virtual space without losing that power of what it is to offer in-person care? We're constantly coming back to that question in the way that we're engaging with community. Also, I just wanted to say too that one of the things that one of the ways we do that is by centering families. So we center family care in our own work environment, in the culture of our connector, um, work environment, as well as when people are reaching out to us. Again, not as a separate silo, but when you center families, that care models out to all aspects of society. So just to have a sense of our reach right now, we've connected with over 4,000 birthing people and families across the U.S. Generally, on average, we're receiving 500 to 600 texts a month right now on our platform. So our volume continues to increase, and with growth is just another opportunity to really think about how can we deepen these health system relationships, referral partners, how can we support our connectors more thoroughly and more deeply, as well, and most importantly, the families that are coming to us for support. So working with health systems, again, that kind of integration that has an intersectional approach is really important to us, and we've been starting those relationships really from the beginning of JustBirth Space. There was the platform component to it, and then there's the reality that people are then going into the health system to receive that care, right? So it's one thing to talk about care when you're in a text with maybe a community-based doula. It's another experience to leave that care model and go into to the health system. And so for that reason, we have really focused on doing trainings around operationalizing, normalizing birth justice as a standard of care within health systems. And so we're working currently with hospitals, with health systems, organizations, community-based groups in order to create these pathways between existing resources, as well as to support the work that JustBirth Space is providing. And so ways JustBirth Space can support referral partners, if you're on that end of things and on this call right now, if you're a provider or you work in a hospital, is one of the things that has been very clear is the feedback we're receiving from providers that this has really helped alleviate capacity issues. They don't have the time to spend with each client, or even one, right? Having 10 minutes could be too long, 5 minutes. So alleviating capacity issues has been a really welcomed part in the way that we've integrated JustBirth Space into other hospital systems. Combating isolations for clients navigating perinatal support systems by connecting clients to community care and perinatal specialists, encouraging a collaborative care model to break silos within systems of healthcare. And so what we're doing right now is working more closely with several hospitals as our key referral partners to customize Community Connect classes for the populations and clients that they're serving, and getting really focused on what are the needs of their patients, so that we could provide that service more directly. Creating a network of referrals across the spectrum of maternal health that may look like acupuncturist, chiropractic, mental health services. Again, really thinking about the continuity of care across the spectrum of the perinatal experience. Trusted support and client satisfaction that's grounded in birth justice and human rights frameworks that center anti-racism and trans and queer inclusive models of care. So the more closely we are working with health systems, the more impact and feedback we're getting about what's working, what's not working, and that translates into people, when they're using the platform, people feeling more satisfied overall with their care. Next slide. And so this theme of community extension can be broken into 4 categories: hospital-based networks, community-based organizations, birth advocates, and parents. So we're currently working with Montefiore Hospital, Elmhurst, NYU Langone. We just started working with Mount Sinai in a new maternal health program. Community-based organizations include Ancient Song and VBI, Morris Heights Health Center, Caribbean Women's Health Association, Public Health Solutions, and Bronx Healthy Start. And then midwives, doulas, lactation specialists, childbirth educators, OBGYNs, social workers, midwives, nurses. Those are the people that we're really wanting to have a stronger, more equitable relationship with. We're also receiving lots of feedback that they're they need support, right? So again, not approaching a health system from an either or kind of mentality of division, but how can we bring these values around humanity together to hear and listen to each other more closely about the challenges of the work. And then our parents, pregnant, postpartum, extended family support systems, all of this working together creates and centers community as an extension of our model. So this is just some direct feedback from referral partners. You can read along, but I'll highlight the third one, which was just a powerful testimony from a community health worker from Queens Healthy Start. And she said, something that resonated for me the most are the core values represented that you are all grounded in anti-racism, but also the anti-capitalist idea that we can take care of each other, that we do have all that we need and the knowledge we need within our own communities. I loved that it can be accessed and circulated in a way that honors all of us and our autonomy. And we just loved hearing that so much. So we're going to shift and talk a little bit more about accountability and why accountability as one of our values has been central to the change that we want to see. So building accountability platforms for birthing families and our healthcare institutions. So accountability is a core value, and we define it as we agree to uphold self-accountability as well as community accountability as a shared core value in the way we center equity, anti-racism, and inclusion with each other and in our work. We acknowledge this also means that mistakes and conflict may occur, and that our commitment to accountability also requires a commitment to ensure that there's a process in place for conflict resolution and repair if consented and desired, calling each other in and honoring our humanness as we learn and grow collectively. And so the deeper we got into accountability work, both self as well as community accountability, it's fine and easy to talk about accountability outside of conflict, outside of harm, outside of hurt. But accountability doesn't always have to be a punitive measure. It can be a growth edge. It can be a learning opportunity. And so that's really how we are centering it, that there's an opportunity right now to evolve, to reimagine, to innovate together that has more grace in that process.
Yeah, one of the ways that we are centering accountability for the people that come into the platform is HEAL, which is our birth trauma processing circle. And this is a online Zoom group that meets weekly. When it begins, it is open and it is publicized and anyone can come in. And then 2 to 3 weeks into the circle, it becomes a closed space. So we give people time to come in, check it out, see if this is what they want to be a part of, and if this is going to align for what they're looking for. Then we close the circle and we meet for many weeks. And that number of weeks depends on how many participants are inside of the circle with us. And we give space for those folks to expand completely on what have they experienced. So they share their full stories, they share their experiences, and they hold space for one another as they each share as well. And then we also equip them with tools for management of these feelings, experiences, and ongoing healing on the day-to-day and kind of future visioning, as well as we equip them with deeper understanding about what accountability can look like, because there's many pathways for accountability. And I think also for people who are the birthing people being harmed in the systems, they're not always clear on what accountability can look like and often are afraid of what that is going to mean for them. So we've started to build a pathway and a care model that holds them through the steps that often starts with this group, HEAL. So through our offerings and our referral partnerships, JustBirth Space has developed these pathways to deepen the accountability work and guide healing for birthing people, for doulas and birth workers who are experiencing secondary trauma, and then also the hospitals and health systems. In our first year and a half of operations, we've responded to a growing need to build out and deepen our support for mutual accountability and healing as aligned with our visions of birth justice, right? So we are not just focused on accountability for some, we're really trying to look at how we can hold accountability for all, and bring together the birthing families and the healthcare institutions for healing, learning, justice, love. Really want that to be said again, for love, for education, and for trauma-informed storytelling. For true systems transformation, accountability cannot be punitive and instead is a pathway to healing for birthing people, for providers, for institutions, and communities. I want to walk you through a bit of a visual. I kind of call it a board game because it does look like we'd be moving our piece along the board here, of an example of how someone might travel through our accountability pathways, and this journey that we're taking them on. So we're focusing on support, trust, birth justice, truth, and reconciliation. So let's say someone texts Just Birth Space, and then soon from that text of asking for either referrals, resources, or just emotional support, they're given the opportunity to join our pregnancy support group. Soon after, maybe they take the newborn care and infant feeding class to learn about the journey before they get there. They continue to come to that group of the pregnancy support group and builds trust. Maybe they even take their childbirth education class with us. They start taking the regular prenatal yoga and finding community there as well. Continuing all along the way to build trust with different Just Birth Space connectors. They definitely use our text line for questions throughout their pregnancy. They make a postpartum plan and a birth plan in the pregnancy support group. And then they birth with one of the Just Birth Space health system partners. And then they have a traumatic birth experience. When this happens, that usually is the way we usually find out about that, is if they come back to pregnancy support group to share their birth story. That's a repeatable pattern in that space. It happened even in yesterday's group, is that we have these people coming in week one, sometimes even from the hospital right after they've had their baby, wanting to sign into the group and share with the friends and community members they've made there that they've made it across the threshold, they had the baby. So that's where, if they have experienced trauma, we're first hearing about it. Then they start attending our postpartum support group and our infant feeding support groups. Often they'll set up a We Connect for birth trauma processing if that comes up. Whoever is facilitating the group spaces, usually if we see that someone is needing a lot of extra support around trauma, we will refer them to have a We Connect and to do a one-to-one session. And then usually we ask them if they would like to join HEAL, which is the birth trauma processing group I was explaining. Then they have a birth review consult, which is someone who can help them to review their birth and also make a bit of sense, specifically if they've asked for their records from the hospital, which often don't make sense to someone who has never worked inside of a hospital. So we help them to make sense of what's on record and what has happened and what it looks like to put those two together as two forms of the story. We also encourage them to attend a Know Your Rights framework class so that they can understand what their rights look like for going forward inside of accountability. They deepen their relationship with their accountability connector. By this point, they're usually working with just one connector that they've built quite a bit of trust with, who's helping them even attend, like when they do have a meeting with a hospital system or have a meeting with their midwife or a care provider, the accountability connector will be present in that meeting as well, helping them to prepare for the meeting beforehand and then being present as emotional support. They have community-centered meetup with their responsible health systems partner. And then our hope always here is that they do find accountability ultimately in the end. And here is a share from one of our participants. Hear it?
I didn't know how much I needed to heal when I first registered. All I knew was my birth had been challenging and that I felt guilty and ashamed and confused. I needed a space where I could talk about it. And HEAL was where I didn't have to hide or pretend I was fine. It gave me the tools I didn't know I needed. I started learning how to ground myself through mindfulness techniques we practiced and developed self-compassion as I practiced giving compassion to others who had had difficult births. It was a really nice format, and it helped me recognize that what happened to me wasn't okay and that I deserved to have been cared for during my labor, that I deserved to feel safe. Erica and MA gave me the courage to follow up with my midwife and the hospital. And while my midwife, who wasn't present at the birth, was responsive, the hospital was not. And so Erica helped me go further, supporting me in talking to patient relations, helping me advocate for myself, asking for an apology and an acknowledgement that my care wasn't what it should have been. I want healthcare managers and providers to know that the ways they provide care or don't matter and have real life consequences. Birth is about human beings, not about efficiency and numbers. The group helped me connect with my own intuition and inner voice, and Erica has helped me take that voice out into the world.
So, so, what we wanted to just end with is kind of sharing what our long-term vision for JustBirth Space is, which is to really have a space that's integrating person-centered, compassionate, holistic, responsive support into the maternity care system. And while the platform meets the heightened need for virtual support during the pandemic, JustBirth Space works to address the long-standing gaps within perinatal support for birthing people and their families. And that is, again, elevating, uplifting our care model is, I think, our way of saying it's not just in a separate silo. It is this idea, this concept, a reality that interdependence, centering hope, centering humanity, is impactful, is trustworthy, and that when we lean into community-centered models of care, we can receive that for ourselves and for others. So thank you. We're gonna open it up to some Q&A. We have 2 questions here just as prompts, but are totally happy to open it up to other questions. But we had 2 questions around: what values do you think are needed for advancing birth justice? And how do you measure transformation towards equitable change in maternal health? Kind of returning to that idea of how do we operationalize birth justice? What does that look like when we break it down? So we'll leave those 2 questions and open it up. And thank you, everyone, for attending and for taking the time to be with us today.
Yeah, thank you so much. I'll bring up too that in the Q&A, Emma answered it, but Samantha was asking if these resources are available throughout the country or for certain states. And so it's a yeah. JustBirth Space is available throughout the US, and we also turn no one away. So we have plenty of people coming into the support groups and classes that are from other countries as well.
And I'm just going to share our contact info too in the chat.
Thank you. Feel free to put a question in the Q&A or in the chat, either one. We can see both. Thanks, Jamie. Jamie says, I love the concept of HEAL. Amazing work. Great presentation. Thank you so much. Yeah, HEAL is a very special space, I will say. We also love it. It becomes a really special container. It's very hard to not get attached to the container. The hardest part of HEAL is when it ends.
Mm-hmm. I'd love to, if folks wanted to share just who you are, where you're coming from, where's your work rooted in? Are you a provider? Are you a doula? What brought you to this conference? And would love to have a better sense. We can't see folks, but we can see just a number of participants. But would love to engage more directly.
Molly asks, are the support specialists paid?
Yes.
Oh yes.
Yes.
For sure. That speaks so much to what I was talking about too, of like giving out and giving in. So all of the same belief systems we have that we put outward, they also come inward. The care comes inward to the connectors as well.
Okay, this is Linda. It looks like we have a question in the Q&A from Rebecca. Are you ready to replicate models in other regions?
We are. I mean, I think right now we're really looking towards growth, and we recognize that we have kind of this model that can be. We think it can be replicated in the relationships established with health systems, as well as kind of a team of people that are rooted in these shared values in our connector group. So we are. Feel free to reach out to talk more about it.
And it looks like we have another question that was in the chat from Janet. What have been your greatest challenges?
I would say tech issues and back end issues. Finding a platform that really will work. We're upgrading our platform next week. When you have glitches around any of that, it interrupts the flow of connection and communication, which is so essential for us. And so really working through some of those challenges as we launched, I would say has been our biggest challenge. Also, worth noting, it is important that that everyone using the platform can trust the security and the privacy of the platform. So that's been a priority to ensure that.
And this is Linda again. I'm not sure if either of you saw this in the chat from Leslie, but mentioning that ACT is already on your resource list, but I would love to offer ACT workshop sessions virtually with JustBirth space group programs.
Yes,
so an opportunity to collaborate.
Reach out to us.
Yes.
So we offer trainings similar to what the presentation was, for free to potential referral partners, to providers, to hospitals. So if that's something that sounds interesting to you or your team, we're happy to set that up.
Also, I think that, Leslie, I'm very familiar with your work through the Journey to Parenthood presentation you did, and that inside of the pregnancy support group would be so welcomed. So many of the things we're covering weekly there is about advocacy and how people can get the care that they need with the providers that they have, and also asking questions about when and if they should change providers. So yes to all of that, please. That would be lovely and wonderful. I love the work that you do.
Okay, this is Linda again. We have another question in the Q&A from Janet. Was it hard to get buy-in from the hospitals?
I would say, like every relationship, any relationship, it takes time to build trust. And I think we really approach equity with that in mind, that equity it's not a one and done approach. It requires getting to know people and as individuals too, not just, kind of like a system and a platform, but who are the people behind it. And so I would say it took about a year of really consistent development of those relationships, where now we're seeing that shift happen, where their patients have had a chance to use the platform. They're receiving positive feedback. They're seeing the benefit in their patient satisfaction. And that took some time.
I also see that that Deidre put in the chat. I'm curious and excited to learn about the ways that evidence-based home visiting can be used to achieve desired outcomes in maternal health, and how innovative approaches like yours can enhance models. And I want to say that, like, one thing I'm frequently telling other doulas in our community, midwives in our community, is like, please let JBS be a tool in the toolbox for you, like, and let us help, right? Because we need collaborative care models. We need wraparound care, right? And so if you're in the home, there's sometimes where you're not in the home, and what happens then? And so when you're getting the care at your own home, right? Because we all, as care providers, we deserve the care we give others. So when you're receiving your care and can't be reached, we could be there. So it's the idea of working as a team that way. And so working as a team, not only with these giant health systems partners, but working as teams also with like self-employed smaller businesses like doulas and IBCLCs, working together there to help lift some of the weight of holding people that honestly right now, birthing folks need a lot of care. And they deserve that much care. They deserve the ability to reach out frequently, to get their questions answered, to have spaces weekly to show up into. But that being the work of one person, that will never work, right? So would love to be on your team, Tidra. I think we have a few more minutes. Yeah. Anyone else have questions? I do love hearing what you all do.
Thanks for sharing your contact info.
Yeah.
Or any other values that you feel like maybe you have incorporated in your own work that you come back to. And it could be some of the same ones we mentioned. What feels, what are some of the values you lean into? I know humor is one of ours too.
Yeah, that's true. It's not on that, but that's my main tool.
That's right, joy and humor.
This is Linda again. We actually have a really great question that just came in from Kai. In what ways do you ensure safety for LGBTQ birthing folks, especially in large group settings?
Yeah, that's a great question, Kai. Thanks for asking. In the group settings, and that's the sphere I'm working in mostly, the beginning of that has to, I mean, let's back up before you're even in the group. So before you're in the group, it does come from our website, our marketing, like we are constantly being clear that this is an inclusive space in all of the ways that we promote outwardly. So whoever has found us, hopefully they have already seen that. But even in case they haven't, the beginning of each space, like even when we were going over who's going to talk about what on the slides today, the part where we explained the 3 tiers and also what our tenets are, I was like, I can talk about that. I say that at the beginning of every group, right? So at the very beginning of each group, there is a conversation, and that's whether it's the same folks that are here all the time, or if there's 10 new people in the group with us, we're talking about always, as we start the group, what Just Birth Space is founded on, what we hold to as our core values and our belief systems. And that includes inclusivity in the space. That includes treating each other well. I frequently just use the word non-judgment as well. Even though I know that wasn't in our presentation today, I think that's a really good way inside of especially the pregnancy and postpartum support groups for people to feel like they can be themselves. Because there's no other time in life that I think you get judged more than in parenthood. It's a time where everyone thinks they get a little piece of getting to tell you what to do. So we really try to make those spaces not that way. And we also explain like where birth justice started, didn't start with us, right? Where it started, and then how we're upholding it and how our belief systems are that if we hold the tenets of birth justice, that all of our spaces wind up feeling more inclusive and caring. I've been running those groups for 2 years now, and we have not had any tricky scenarios yet. And I do think that has to do with that there's many layers of the work to make sure that the queer folks in our spaces are protected, and that they are not only protected, but also uplifted and allowed to be their whole selves in the space. I mean, we also do have just a queer family space too. I will note that as well, that like there is a space that's just for them, which is also, I think, important sometimes.
And representation, I think, within our community.
Yeah.
That's centered and important.
Yeah, I don't actually know the numbers, but like a lot of the connectors are queer, you know, so it also has to do with who's who's in the space.
Mhm.
Oh my gosh, the countdown clock is happening.
Any other
minutes.
questions?
You know there's something on your heart. Let it out.
That's right. I love to hear some of the, the cross sections of similar work happening. I think we feel very much that this is a movement that we're building on. We're part of something with other people, and that feels good. When we think about community extension, there's so much incredible work happening right now, and we need each other. And so it's wonderful to connect. So please reach out to us, connect with us. We want to hear about the work you're doing. We don't have anything that's like directly. I'll read the question. Do you have support to address opioid use disorder? We don't have that directly. I would say, we would lean into our resources for additional support through some of the other health systems and community-based organizations that we work with.
Yeah, I see Kai saying my concerns that sometimes spaces are LGBTQ friendly, but not necessarily trans or gender expansive centric, which adds to a sense of isolation for trans and gender expansive families. Yeah, I do. That's why I note that it's like, is this postpartum support group, for example, that is not like trans centered. It's just family centered. It is definitely inclusive, but then the queer family space is that. So if people are looking for a space where it's going to be, only centering, then we recommend they go to both, and they're on different days, so you can get the support in both containers.
Mm-hmm. I think too, in this work, it often when you're talking about particular groups or particular values, it can feel very tokenizing and very check the box approach. And so it is the work of community building to integrate what it means to have spaces that are genuine, And that may mean we're learning together to do better, but I think we really made a point to create something that isn't just a one and done, let's just say it but not live it. And so I think our community is a reflection of living it.
All right. That's our time. Thank you so much.
Thanks
It
for
was
being
great
with
to
us.
be with y'all. So good to get to know you.